Hello and welcome to a Wonder Care podcast. I'm Sheena Mitchell, pharmacist and mum of 3. I combine healthcare and practical advice to support you on your parenting journey. I bring you this episode with the support of Salin Plus Breathe Easy Salt Therapy device. Today I'll be talking with Dr. Niamh Lynch. We thought it would be very interesting to discuss the long-term neurological effects of measles, mumps, rubella and chickenpox. We then explore the arguments for vaccination, both with the MMR and the chickenpox vaccine. Today I am joined by Dr. Niamh Lynch, who is a consultant paediatrician and paediatric neurologist. And you are a graduate of University College Cork, and you won a whole load of medals and prizes while studying, and then went on to obviously do your training in Temple Street and in Crumlin and in Cork University Hospital. Can you tell me a little bit about what it is like to be a paediatric neurologist? I feel like I don't know what your day-to-day looks like.
That's a good question. That's not something I get asked very often, actually. So day to day, the kind of things that I deal with are mostly children with headaches, epilepsy, or sort of more chronic neurological conditions, sometimes as a long-term consequence of an infectious disease. So there's a wide variety of things. So my typical day would be I get up, get breakfast, get the kids to school, get the dog out to daycare if he's going to daycare, get into the ward, do a ward round. So I do general pediatrics as well. So there might be a number of kids who've been admitted with various infectious diseases in wintertime. And then the occasional child who has come in because they've had a first seizure at home, or they've had an episode of collapse that can't really be explained, or they have headaches, or they have developmental problems. So that would be a huge thing what I do as well. So either developmental delays or regression in development. So those are the kind of things. So I do my ward round. Then I go out to my clinic and see outpatients there. So that again would be mostly follow-up from the hospital, seeing children who have migraines and epilepsy and other neurological problems, and just making sure that their medications are up to date and that they're on the correct treatment and that their symptoms are controlled. Okay.
And so your hospital work happens in the Bon Secours in Cork, is that right?
Yeah. So we're the only acute pediatric inpatient private facility. So, we're the same as any other acute hospital unit. We'd be similar in size to the Mercy Hospital in Cork. The only difference is that parents and patients who come in have health insurance. About half the population has health insurance anyway. So it's very similar to any other hospital, really. And people are surprised when I say that because they don't realise that there's an acute paediatric service there, but there is.
Which is great to know if you're in the area. And I know I've seen you post about that before. And, as a parent, that's very reassuring.
We get kids from everywhere, really. People have come down from Dublin. People come from all over, really, because, look, the reality is that emergency departments are crowded, and if we have a bed, you go straight into the bed. So, it's just a clear pathway for people. So they know that they're not going to be waiting for a particularly long time. So people do travel. It'd be great if there were more units like that. Well, look, and what would be really great is if pediatrics was well funded and well resourced all over the country. That would be the best thing. But as it stands, this is probably as good as it gets in terms of speed and efficiency.
Okay. I want to talk for 1 second. I just want to emphasize to people that you have an amazing Instagram page where you share a wealth of information, and it's really, really a great resource to people. And the fact that you love dogs is another reason why I love hopping on there, because I'm a bit dog obsessed. How did that all start, and do you enjoy that?
The dogs or the Instagram?
You can pick.
The Instagram started, why did the Instagram start? I was on Twitter and during the pandemic, and there was a lot of information and misinformation on Twitter. And it just felt like, you were kind of swimming against the tide really there. And somebody sent me a message and said, you know what, you should actually start up an Instagram page and share some reliable pediatric information, because people weren't able to access their GPs or any of that kind of usual stuff that they would have during the pandemic. So I was like, oh God, that'd never take off. And
how many
within
followers
about
do
a
you
month,
have now?
I have about 42,000, but within about a month, I'd say within about 6 weeks, I had about 10,000 followers. I couldn't believe it. Like, it
Mad.
was mad, and it was kind of embarrassing because I'm not like I'm a geek, that it's not in my nature to be out there. And like, I remember going into work the day that I hit the 10,000, and all my, like, the Bonds is a lovely small hospital, so everybody knows what's going on for everybody else, and all these people were just like really giving me a hard time and teasing me. So yeah, so look, it's been a weird journey. I've pulled back a bit now because I think people have more ease of contact with their regular healthcare providers now, and really, it was just about sharing information, just to try and counteract all of the really serious misinformation that was out there.
And I love that. That's why I started Wonder Baba, which is Wonder Care now, after my baby was born 10 years ago, my eldest. And as you know, a healthcare professional, when you go online, it's very frightening sometimes. The information that you see, you're like, no, in Ireland, we really do need a safe place for people to come to access simple healthcare information. So well done you. And during the pandemic was just a wonderful time to do that, when people really needed resources and trusted, I suppose, healthcare information. So today we are here to talk because I've been speaking a lot about chickenpox lately on my podcast and in the media.
I'm scratching myself here.
As soon as you mentioned
You're talking
chickenpox
about it,
or
yeah.
head lice,
Ugh.
I met someone the
Yeah.
other day who actually came up to me, and it was just after I released the head lice episode, and they come up and they just said, I didn't get through without scratching my head, because you just can't.
Yeah.
But
Skin starts to crawl.
it does. So I've spoken a lot about chickenpox. So I know people are fully aware of that. And if anyone wants any information about kind of the over-the-counter remedies and treatments and kind of home hacks to treat chickenpox, that episode is there for you. And I also have one which has a conversation on the vaccine, but we might talk about more about that later, because I'd love to get your view on that. I suppose I was very careful not to share my personal view on that episode, because I feel like I don't have all of the information that exists. I'm not sure it exists, a right and wrong scenario with that particular vaccine. So I just tried to outline the pros and the potential cons as they are now. But we were obviously chatting online and said it would be really interesting to have a little look at measles, mumps, rubella, chickenpox, that kind of thing. And you are obviously bringing in your expertise of the neurological complications that can happen to children after that. So I might just highlight brief sentences on those conditions just to explain, I suppose, what they are. So starting with measles, obviously highly infectious viral illness that starts with cold-like symptoms that develop about 10 days after you get infected, and you then get a measles rash a few days later. Usually get high fever, little white spots in your mouth, loss of appetite, and that kind of thing. The spots with measles rash are obviously small red-brown little spots, and they appear 2 to 4 days after the symptoms and takes about a week to fade. So then we have rubella, which is also a contagious disease caused by a virus, and it's spread, like we're very familiar with viral spreading now, but close contact through coughing and sneezing. And again, it has a rash. And mumps, another contagious viral infection, which used to be really common, but now we have the MMR, which has kind of obviously dampened down all of these viruses. But it's really recognisable because you get swelling on the sides of the face, just under the ears, at the parotid glands. And, I suppose it's often described as hamster face. So that's quite defining for mumps. So they're the kind of three illnesses that I just wanted to give that outline because I haven't discussed them on the podcast so far. And obviously they're not something that has been circulating very widely. I know before the pandemic started at work, we would often hear, and it was funny, it would be in like buildings of, office buildings and stuff, of people, outbreaks of, say, mumps happening. And it's interesting. And measles, I know there were some cases in hospitals, again, just pre-pandemic. And so the health authorities were obviously warning us to be kind of vigilant. Is measles common now at the moment?
No, so the last measles report we have from the HSE is back from 2018. There was a couple of clusters of outbreaks back then. There was five outbreaks, and then there was about 67 cases, and then a couple of linked cases as well. So that means that it was passed on to people. Basically, most of the people who got measles in that cohort were under the age of 1. So they were too young to have been vaccinated. And the measles was brought in by somebody who was obviously unvaccinated and traveling. But once it, gets into a community, it is highly contagious. It's one of the most contagious viruses there are. And the problem with measles is that about 30% of children who get measles will need to be hospitalized, which is huge. So if you get a measles outbreak, then there is going to be a significant burden on the emergency services and children's hospitals. So it's definitely a nasty one in terms of the short term. Children get very sick. Now, when I worked in Nepal, children who, they would be generally, back then anyway, prone to a bit of malnutrition. Children who were low in vitamin A and get measles can get very unwell indeed. That's not so much the case here in Ireland, but it is a serious illness. The immediate sort of symptoms would be, the rash and the discomfort and the sore throat and the red eyes and things like that. But there can be complications, obviously. The most common one is pneumonia. Measles pneumonia is very severe, and that's usually what leads to hospitalization. But there are neurological complications as well. So they can get a measles encephalitis, which is an inflammation of the brain caused by the virus actually infecting the brain. They can have symptoms of meningitis, and they can get a thing called ADEM, which is acute demyelination of the brain. So it's a bit like an acute attack of multiple sclerosis, to simplify it. So basically the white matter in the brain gets attacked and damaged. Now, they can recover from that, but it's obviously a very huge hit for a brain to take and for a child to try and recover from. And then there's a horrible thing called subacute sclerosing panencephalitis, which is SSPE, which can develop 15 years later. And it's basically an inflammatory condition of the brain. The brain starts to misfire. You have regression. So, the person becomes withdrawn, may develop seizures, loses, becomes severely neurologically affected, and ultimately will usually go on to die. That's rare, but it is a real complication of measles. So those are the kind of things that worry me as a pediatric neurologist, or the neurological implications. But for all children in the short term, they have a 1 in 3 chance of ending up in hospital because of this illness.
God, that's actually so frightening. Now, I know obviously that's worst case scenario, but I actually...
Well, see, I worked in Dublin during the measles outbreak back in the noughties, 99, 2000. I was there, I was in Temple Street, and I just saw some really horrible things. Children who were very, very badly affected, and at least 1 or 2 subsequently passed away. So, it's not to be trifled with. It's a very, very serious illness.
Okay. And
I'm that old.
No, I'm like, I think we're probably around the same age. But anyway, we're really young. Really, really, really young.
Yeah.
Rubella. I haven't heard of a case of rubella. I haven't.
Yeah,
checked.
German measles. If you remember the phrase German measles, I had it myself because I am that old that there wasn't a vaccine. So I remember it myself. Actually, it was about 5 or 6 when I had it. You do get a rash with it. You do feel kind of miserable, muscle aches and pains. Again, sore eyes, sore throat. But you know what? It's fairly mild for children, but it has significant implications if a woman who is pregnant gets it, particularly in the first or second trimester. It can cause significant issues for the developing fetus, and one of the most common effects is congenital deafness. So there were, back in the 70s and 80s, it would be reasonably common to meet somebody who had hearing loss or absence of hearing because of congenital rubella.
And is that really why we screen for or, for immunity during pregnancy? Yeah.
Yeah. Now, it has other more serious effects as well during pregnancy, that can result in, miscarriage and things like that. But, if the pregnancy continues to the end, then the more common one is deafness. Yeah.
Okay. Mumps. So, as I was saying, I feel like there was definitely outbreaks going on pre-pandemic.
Yeah, there were. Yeah, pre-COVID there were. So basically, there was a spike, I think, in maybe 2019. So what happened with the mumps is that it's really important that children get their booster for mumps. So the way when they're in babies, junior infants or senior infants, to get a booster, and that's the MMR booster. And particularly mumps, immunity wanes. So if you look at the age profile of people who were getting it, it was people like in their teens, 20s and early 30s. And that was a kind of a twofold cohort. One was the group that didn't get the booster. And one was the group of people who, around the time of the Wakefield scandal, and it was a scandal, back in 1998, there was a big fall off in the number of people actually getting vaccinated at all. And those young people were hitting their college years around 2018, 19 and 20. So they were 18, 19, 20 years old. And it was spreading amongst those people because they didn't have any immunity to it. So it's a very painful and unpleasant condition at the best of times, but it can cause an orchiditis, so inflammation and infection of the testicles in males, and can lead to long-term infertility for men. The other thing, it can cause an encephalitis as well. So it can cause neurological complications, not as frequently as measles, but it is a recognised complication.
Okay, and then in terms of chickenpox, I don't know if you're seeing a lot of it in the hospital setting, but certainly in the community, there are a lot of outbreaks of chickenpox this year. I would say more than normal. Obviously, look, it's not a notifiable disease. We don't have figures, but certainly, you know, from my work on Wonder Care, there is a lot of chickenpox going. I wonder, is that just, obviously there's going to be a reduced amount of immunity because kids haven't been able to spread and share the love as they would have pre-pandemic. It's not something that you're seeing translating into hospital cases anyway?
No, I'm hearing about it a lot, but the kids who tend to get hospitalized with chickenpox in the short term are children who have underlying skin problems. So typically your child with eczema might end up with a more severe rash and be a bit more unwell and uncomfortable with the chickenpox. So those are the ones that we like to keep an eye on. They might need to be admitted. They might need, if they're showing signs of skin infection, they might need antivirals and antibiotics. So in the short term, it's the kids with skin issues that end up suffering the worst consequences. The other kids that end up quite unwell are if they get it around their eyes. We have to be very careful because it can cause injury to the cornea and things like that. So they need hospitalization as well for care. And obviously, if their mouth is very sore and they can't eat and drink, they might need to come in for IV fluids. So it's not nice in the short term, right? But I hate chickenpox because of the neurological complications that it can cause. And I've seen them, and I would never wish it on any child. So chickenpox can cause a couple of things. One of the milder complications it can cause is cereballitis. So your cerebellum is the part of your brain that controls your balance. So children will lose their balance, start to fall over, have difficulty eating and drinking, speaking. They can be very unwell with it, and you just have to sort of support them through it and treat them and make sure that they're safe and not going to injure themselves. But that resolves. Okay. Then there's encephalitis, which again, is a very dangerous, unpleasant condition. And then the other thing that they get is a vasculitis, so inflammation and swelling of the blood vessels that supply the brain. So one of there's two possible outcomes of that. They may have a bleed into the brain, or they may suffer a stroke. So, the neurological complications of chickenpox are really serious and not at all trivial, which is why I think that we should have a chickenpox vaccine, because I've seen the extreme end of what can happen, but also the fact that when your child has chickenpox, you're basically out of circulation for 2 weeks, right? And they don't all get it together. So if you've more than one child in the house, the next one develops it about 10 days later. So that's another 2 weeks. And that's very difficult for people as well to have to manage. And it's 2 weeks of misery. It's not, and then it goes from maybe a week of discomfort into a week of extreme boredom, and that's the best case scenario. But the worst case scenario is that they end up in hospital with a serious neurological complication.
How common? Do you have kind of, I suppose, stats for how common it is? Because, you hear a lot that in the majority of children, it's mild.
I'll have to check my stats there now, 1 second. I mean, I can tell you it happens. One second now.
Ultimately, the fact that it's happening is enough fear for any parent,
Children who develop chickenpox may be at a 4-fold increased risk of stroke in the following 6 months. So it increases your risk of stroke 4-fold. Now, how many? I don't have your numbers per so many in 100,000 or anything like that. I guess I'm the hammer. Everything looks like a nail to me. Do you know what I mean? So when you see these complications, you kind of resolve that you're never going to, you're never going to let a child have chickenpox ever again. The best study I can quote for you, right, is that stroke is rare in children, but it does happen, and it's as important to know the signs of stroke in children as it is in adults, right? But in a study of 70 consecutive children in America, who'd had a stroke, a third of them had chickenpox in the preceding year. So there is a correlation between chickenpox and stroke.
I just want to take a little break for a second to say that I'm delighted to partner again with one of my all-time favourite products, Salin Plus. This is the world's first 100% natural dry salt therapy device. It's clinically proven to relieve a wide range of allergens and respiratory conditions. The salt therapy method has been trusted for generations and is now hugely popular worldwide as more and more people recognise the superb results achieved from a natural and non-invasive method. This device will help you breathe easier and sleep better. Okay, sold on your views to vaccination. However, right, just for the interest of conversation, because my perspective on this is that it is just not as simple as let's roll out a vaccine program for all children for a few reasons. First of all, not every child can clinically receive a live vaccine, if they're immunocompromised or whatever reason, that they're just not able. So I suppose ultimately those children aren't going to be exposed as children then, because if we have everyone else vaccinated, it's not circulating so much in childhood. And as we know, chickenpox becomes a more severe disease as you get older. Are we then potentially putting those children who can't be vaccinated at greater risk of contracting it at an older age?
So you're into the realms of herd immunity there. So you need 95% approximately uptake of a vaccine for herd immunity to be bestowed, and if you have herd immunity, then that person is buffeted and protected by the herd around them. So there's that argument. I suppose the best evidence we have is to look at what has happened in countries where they've introduced the chickenpox vaccine, right? So in the USA and in Australia, the vaccine has been there for many years now, and they're just not seeing that problem emerging. The other thing is that you have a specific immunoglobulin, varicella zoster immunoglobulin, that you can administer to people who are high risk if they're exposed to chickenpox. So there is a rescue treatment there, so that you're not sort of saying, "Oh, tough, you have chickenpox."
Take your chances. Yeah,
there is measures and protocols that can be taken for people who are vulnerable, high risk, and exposed to chickenpox. So you have your sort of safety net there.
Okay.
I think on a population-wide basis, the argument for chickenpox vaccine is strong, but obviously I see where people are coming from. But what bothers me about some of the narrative in this is that, if we introduce the chickenpox vaccine, adults won't be regularly exposed to chickenpox virus, and therefore they may be more prone to shingles in later life, because we know that exposure to the chickenpox vaccine from the pediatric population boosts the adult's immunity so that they're not prone to developing shingles. I don't think that's really fair when you look at the suffering that's being inflicted on children so that we can stop adults getting shingles. I don't think that's fair. I don't think that's just or equal. And there is now also a vaccine for shingles. So, in an equal sort of dialogue, you should consider the needs of children as equal to the needs of the adult, and consider the potential devastating consequences of a complication of chickenpox for a child.
I totally accept that, yeah. One thing that has me concerned is that obviously the established, I suppose, length of immunity for the chickenpox vaccine is kind of 15 to 20 years. So say if we go, right, gun-ho, it's on the childhood schedule, let's go for herd immunity, which obviously is an ideal scenario. My concern would be that in 15 to 20 years' time, and this is more a concern with the management and planning of our government, because I think at that point, we need to be proactively either giving a booster vaccine, because you've got all these, say you have a 6-year-old child, little girl who gets vaccinated now. In 20 years' time, she's 26. She's in her childbearing years. We do know that there are huge risks associated with chickenpox during pregnancy. And so I don't think it would be fair to our children now, just talking about equity for children and taking their needs into consideration. I think it would be reckless for us not to consider them as adults and their potential childbearing years. So I think there has to be, if we're rolling it out, a commitment that we're not rolling it out as a one-off childhood vaccine, that there's either immunity checks done, but like you can't do an immunity check every year if someone's 20s on the chance that they may get pregnant, you know what I mean? And a lot of people, like the age of child, like, you know, you can be pregnant from the age of 17 to 50, you know. So I think we need to have a second rollout, then a commitment to a delivery of a national live vaccine rollout again, unless obviously immunity can be proven to last longer than the current SPC 15 to 20 years, which it is at the moment.
Yeah, the only thing I'd say to that concern is that the vaccine has been present in the States now for approximately that time span, if not a bit longer. And they're just not seeing that happening. You know, that because your reservoir, if you like, of chickenpox is the pediatric population. Once you get immunity within that population, it tends not to trickle up, you know. So I don't know is the answer. I suppose I'm just seeing the devastating consequences of chickenpox, vasculitis, stroke, severe infections, things like that, you know.
Your point there is very valid, and I hadn't really thought about it that way. But, you know, if you've got a 26-year-old who received their vaccine when they're 6, well, all the children around them are, you know, that are 25, 24, 23, all the way down to, you know, 1 are vaccinated. So you're right, you're still going to have herd immunity protecting those people. That strengthens the argument for sure.
Yeah. Yeah.
Yeah.
Like, it's not like we just vaccinate one cohort and let them off. It's a rolling thing. Do you know what I mean? So that's where, look, you know, I mean, these discussions are way above my level of qualification anyway. And, you know, they're advancing the discussion and the dialogue in the UK. And typically when something happens in the NHS, it happens pretty quickly in the HSE as well, in my experience.
20 years, you know, you're talking. I'm like,
yeah, but with regards to vaccines and with regard to, there was something else that came in recently. Oh, I can't, was it one of the heel prick tests or something? That had been introduced in the UK and was the SCID one, you know, the one about the severe immune deficiency. I think that was a UK move, and then it came over to Ireland pretty quickly, you know. So
I'm a strong advocate for following your neighbours, you know, because clearly the UK, to be fair to them, I've seen that as pharmacists, they have huge resources available to them, and the capacity for research and study is greater than it is here in Ireland. And you know, generally, like, you don't need to reinvent the wheel in terms of healthcare systems, which is what I've been talking about in the practicalities of the pharmacy world, in that I've been talking a lot about a minor ailment scheme and that kind of thing, which works very successfully in the UK. So yeah, it'll be very interesting to see what the UK decide to do then. And I think I didn't have an opinion. That's what I said. I couldn't form an opinion. And I think my two concerns you've kind of addressed. So look.
But then, you know, I'm not an immunologist or an epidemiologist. So, I mean, I'm just, those are my opinions. Like, they're not, they're informed by my own reading and my own experience, I suppose, of the severe effects and impacts of chickenpox. But I know it's not a perfect vaccine. It is a live vaccine. It's not perfect, but it's still, I think it still has merits, and it still warrants good discussion and good analysis of the pros versus the cons.
And I understand your perspective coming from seeing, you know, the worst case scenarios, I suppose, surrounding the conditions. You're absolutely right about the shingles vaccine, and while it's available, it's not currently a reimbursable vaccine. So far, the government haven't taken a proactive attitude to lifelong vaccination programs. It's just really the childhood program we have. And shingles, I think, did they see in the USA, by the introduction of chickenpox vaccine, right, they saw the average age of people affected by shingles reduce. So instead of being something that was, you know, kind of happening to 60-year-olds, is now happening more in the 40-year-old age. So
who would have had their immunity boosted by exposure to children with chickenpox, but that's no longer happening. And that's why the shingles is coming younger.
Yeah. So I think, obviously, look, they're all caused by the same varicella virus. And I think if you're looking at one, you have to kind of look at the other, really. They're kind of part and parcel.
Yeah. And I forgot Justin Bieber. So Justin Bieber had this thing called Ramsay-Hunt syndrome, whereby he had complete paralysis of the facial nerve. And that is a late onset complication of chickenpox as well.
God, I did not know that. My Bieber information is not obviously to a high enough standard.
See, I'm such a neurology geek that kind of thing now I found very interesting. But yeah, it's a varicella complication.
And just before we kind of finish up, you mentioned earlier fears that people had surrounding the MMR. I think it's really important to say that there was one study which has been completely defunct that drew a link between developmental conditions like autism and the MMR. And there has been so much research done into that area, and it has been completely disproven. So I really, really just urge patients to feel confident in the MMR. And obviously, talking to you today, Niamh, there's not really a good alternative. You don't know, with immunity to everything is weirdly affected, and I think we'll be seeing that for a few years post-pandemic. We saw it with the strange RSV seasons over the last 2 years, and influenza again was a bit erratic this year, peaking early and hard. I think we'll have an interesting few years before things settle back down. And with obviously people travelling so much, there are a lot of countries that do still have high levels of things like rubella, and so it's important to maybe review decisions that you may have made about vaccination and try and be proactive. I think for that generation of children who were not vaccinated by parental choice back in the late 90s, early 90s, they're now coming into adulthood. They should check. They mightn't know their vaccination status, so that's something for and some of them are starting their journey of having families and things like that. They may not have gotten their booster, for example. So the sort of people in their early 20s now should probably try and find out what their vaccination status is, Yeah. Important to know. It is, and it's no good waiting till you're pregnant, because a lot of the times people, aren't planning to have a baby, so it's better to I suppose.
Well, the majority of pregnancies are not planned, so
yeah,
it's something it's good for everybody to know anyway, especially with the mumps as well, for male fertility.
Yeah.
It's not just women; it's men as well. That it can affect fertility, so it's good for people to know. They did offer, I think, in UCC, I think they offered they certainly had an outbreak there a couple of years ago, and I don't know if 100% sure, but I think vaccination catch-up might have been offered. I'm not sure though.
Yeah. Okay, thank you so much for all of that information. I did learn a lot about the neurological effects. I told you I was very clueless coming into this, and it's actually quite frightening really, because you do tend to think about mild illness. So it's important to hear every side of the story and to kind of...
Well, look, I mean, I don't want to be like, little Miss Scary over in the corner. And these complications are rare, but they are real and they're avoidable. That's the thing. They're completely avoidable.
Yeah.
So that's the important thing for people to remember.
Thank you so much. I really hope that you have found the information in this podcast episode helpful. If you did, I'd really love if you could give us a little review on Spotify or Apple Podcasts or wherever you get your podcasts. That helps me to get more free, accessible healthcare information out to parents, because the streaming platforms start to show my podcast more. I really, really appreciate everyone listening and joining in and helping and sending in questions so that I know what you want to learn about. And I'll be here soon with another infectious disease for us to tackle. Don't forget to keep an eye on my Instagram page at wondercare_IRL. You can pop any questions you have into the question boxes when they open so that I can address your question during a podcast. Thanks for listening.